Well, that was a lovely, lovely conversation. I think that what we need now is to have some validation, right? Because that is very important for any kind of healing, you know? So let's invite in one of our favorite doctors,
Favorite.
Dr. Catherine Toomer, Toomer Talks. Hey.
Yeah.
Toomer Talk.
Hi, hi, hi.
Hi.
How are
Everybody's
you?
getting so excited. You come on every season at this point. I love it.
Good. I love it.
Good.
I'm a regular.
You are a regular. Yeah. That's what I
Love it.
do. Like the doctors that are like I'm closer with, like that are regulars. I'm like,
Mhm.
those are our doctors. Those are plus size doctors.
I agree.
I mean,
I
I
was like,
remember
my
when this
doctor.
started, so I was just like, "Oh my!" And if I had been probably more comfortable at
Yeah.
that point with TikTok, I would have begged you to be one of
Oh.
the hosts. I want to be a host.
Oh no,
But
I saw you. I was like, that one. Because when we
mhm,
started on TikTok,
mhm,
Dr. Toomer, right? Like everybody was so full of shit. Sorry, Dad.
mhm,
And it was like, I mean, we're taking it from the diabetics. Skinny
mhm,
people shouldn't take this. Like it was just
mhm.
a big pile of awfulness. And you were like, I'm Dr. Toomer telling the truth. And you just
Yep.
said all the things. And I was like, oh, she knows all the things. We have to have her on the show, you know?
It was great too.
I
Yeah,
know. And we had
yeah.
such a good time, right? We had like,
Mhm.
and especially the first season. I mean, you've come on about every season, which has been
Yeah,
just
this is my third time, isn't it?
Yeah, it's the third
Third or
time.
fourth.
good
It
time.
was
It's your third
great.
time.
Yeah.
Yeah, it was
But
great.
who's counting?
Good.
Yeah,
Just,
it was counting.
you know, I don't know if I remember to mention this last time you were on, but
Mhm,
when Oprah had her special and someone said that fat bias was the last discrimination that we tolerated, I was like,
mhm.
you heard that on my show with Dr. Toomer. Like, why
But that's
didn't you quote her?
Dr.
I quote you
Yeah.
all the time.
No,
I quote you all the time. When I say something that's the tumorism that I
mhm.
got from this show, I'm like, that's from Dr. Toomer.
It's
I
funny.
do.
My assistants, what they do, they started recording my meetings because they're
Oh,
just like, you speak in sound bites. Do you
you
know that?
do.
I'm
You
like, I
drop
do.
these gems, and then we all just
Yeah.
go. Like and
So
you never know when it's
that's
going to come
funny.
out. It's like stream of consciousness. You know what I'm saying?
Yeah.
We got to
It's
record it
it's really
all.
interesting. It only happens when I'm talking to people. If I'm talking
Yeah.
in my head, nothing ever is
Oh,
in
same.
there.
And
It's
me
just it
and
only
my
comes
husband.
out when so it's you guys. You bring out the best.
Oh, I love
Yeah.
it. Well, you bring out the
So
Love
best
it.
in us,
yeah.
so we're glad to have you here.
Thank you. I'm glad
Yeah.
to be here.
Okay.
So what we did today is we don't have like a ton of questions because we have
Okay.
such good, like round conversational, you know what I mean?
Mhm.
Like,
Yeah.
so we're just
No
gonna
problem.
kind of have topics and discuss them from there.
Okay.
Obviously our guest struggled with obesity for a long time. Yeah, he's very open about the fact that he was borderline diabetic, that he had a doctor that, you know, got other kinds of labs and stuff and fought
Mhm.
for his diagnosis. So he was able to get his medicine. He talks a lot about being a man and coming out, you know, about all of this and you know being a creator in the community as well.
And
And I think
getting
that's
men to
so
pay
important.
attention to their health and their health care.
Yes,
Mhm.
Women are
and
like
Oh, I
not and
agree.
not
more.
just men, African American men as well, because
Yes.
he says,
Yes.
like, and he talks a lot about how there's
Yes.
stigma
Mhm.
around the whole idea of like
Oh,
talking about
absolutely.
mentality and weight and stuff. So I think it'd
Mhm.
be super cool to talk about like your take on that for sure.
Oh,
Um,
absolutely.
yeah, yeah. All
Um,
right.
so I have a what's considered like a hybrid group, and it's a group of patients that we get together once a week live,
Mhm.
and we talk about any issues. And then once a month, I meet with them one on one. I see the men one on one; they never come to the group
My
ever,
gosh.
ever. Most of them are spouses of some of the people I've worked with before,
Yeah.
or I've worked with them and then I end up working with their wives or their husbands. And but and when it comes to group support and needing, they just simply will not come in. And I understand that. And I mean, I'm married. I talked to my husband about it.
Sure.
And so I understand it. I mean, I understand,
Mhm.
and I don't obviously don't shame anyone for it. Um, but it's just this is not a spectator sport,
Mhm.
but yet people have all these opinions.
Oh yeah.
And so when you're already someone in society who has everybody telling you there's something wrong with you, as it is, the last thing you need is for you to be doing something that's actually positive and healthy, and
Mhm.
then have that become the focus of someone's negativity. And I understand just wanting to keep something to themselves.
Yeah. I do
I
too.
mean, it's like why provide we deal with enough prejudice. Why add something
Yes.
else?
Yeah, I get that. It's a
Yeah.
lot. And I think that it's so brave
Mm-hmm.
when these men have been coming out and on TikTok specifically, they'll
Mm-hmm.
do lives together
Yeah.
and talk about this. And
Mhm.
it's just it's for exactly those reasons that it's like
Mm-hmm.
especially brave. You know what I
It
mean?
is. It is.
Yeah.
And I can tell you, as you know, my husband who really does spends a lot of time watching TikTok, YouTube videos. He doesn't
Mhm.
watch TikTok, but he does watch YouTube.
Mhm.
And so, having any type of platform that allows men to speak that then is put out on YouTube really does make a difference. It has an impact. It really has an impact.
Yeah.
And so I think that as we and weight loss in general is a very feminine
Yeah.
Yes.
realm. I
Yeah.
mean,
Well, I
we
think
just
that
and
is.
mainly because our appearance is so being overweight is far more tolerated in men than women.
Yeah.
Mhm. Yes.
And so what happened, and our appearance matters. For men, it's their finances. For us,
Mhm.
it's our fineness, so to speak.
Wow.
So, so therefore our appearance. And so that's why weight loss and appearance have been tied together, even though they're not, and really trying to become weight and health has been so difficult because everyone just assumes there's this vanity involved. One,
Yes.
two, my thing is, so what? Even if vanity is involved, I'm allowed to be vain. I
Yeah.
mean, if I want to look a certain way,
True.
I'm allowed to look a certain way.
Why not? Eh,
There's nothing wrong with wanting to feel good about yourself or whatever, as long as it's done in a healthy way.
yeah.
And it's not a maladaptive behavior in
Right.
some way, or it becomes obsessive in some way. And
Yes.
so it's really hard. It's sort of like having an eating disorder and having to eat. It's sort of the same thing.
Yeah.
It's something that's required of us for health reasons, but it's too easy for it to tip over into something else.
Yeah. I think that's true. I mean, and I think that what you're saying too, like about people coming out like on YouTube, and we have seen like a ripple effect. Now it's not
Mhm.
anywhere near as large as it is, I would say, for the creator community for females. But it is it is interesting because once somebody decides to create, right?
Mhm.
Once they do, they'll say it was because of this person that I saw that said this thing. And
Mhm.
that's for everyone. But now being able to see the men, because I will say when we first started here, there were no men.
Not a lot of men.
Very few.
I think
There
Jamie,
was one. Now there was one. The
yeah,
gentleman who was on the very first time I came on
it's
your
me and
show.
you. Yes, his name's
Yeah,
Jamie. Yes, he
yeah.
was one.
And
He
he
still
and he
creates.
he's fantastic. I can't even. It's so crazy. This
Yeah.
man has gone from 700 plus pounds down to 200 plus pounds,
Yeah.
and still going. And people are still telling him how he's doing it is wrong.
Oh
I'm
my
like, what the
gosh. And he got medicine. He did medicine and
Mhm.
surgery because he was on a
Well, he
show.
did medicine first,
Yeah.
got down to a certain point where
Yeah.
surgery was safe for him, and
Yes.
then he
Yeah.
went on to do more. And he did it for him. That was the perfect combination.
Yeah.
It worked for him.
It
Yeah.
really
And
worked for
everybody's
him.
different. I mean, like, that's something
Mhm,
for sure Kat and I discuss a lot,
mhm,
is, because Kat and I are, if you look at our numbers, we're looking good, right?
mhm,
But ultimately, if you look at just BMI, we both still have
mhm,
obese BMIs. Now, we all know that this is a disease, and regardless of the BMI, we have obesity. We've
mhm,
learned on the podcast from
mhm.
you and from
Yeah.
others, right? But I think that there are times where I think, when am I gonna have to pull out surgery? Right? Like,
Mhm,
is that when but I want that tool to be the last tool I have to pull out.
mhm.
I think that's kind of
Yeah.
where I'm at,
True.
because I did the
Mhm,
lap band surgery, and that was just, behavior restrictive, right?
mhm.
And eventually I ate through that because I have obesity, you know what I mean?
Yeah.
But I saw it for me, I know that it will change, but then we've had some surgeons on the show that have said, really, like 3 years, the food noise is gonna come back. So you probably have to be on a medicine anyway, or you'll do gastric
I've
bypass.
not seen that.
You haven't? What have you
I've
what
been
have you
prescribing GLP-1s for 15 years, and I have never seen food noise come back.
even when they're on or after surgery?
Oh, meaning
After
from
surgery.
surgery? Oh,
Yes.
you
Yeah.
mean
From surgery. From
from
bariatric
surgery? Yes.
surgery.
I
Yes.
thought you meant from the GLP-1. No,
No,
no.
no.
But
I
yes,
definitely
from
have had.
surgery. It's well, mainly
Yeah,
because surgery, like you said, it just changes behavior, it just
yeah,
restricts how much you can eat.
yeah.
Most of us are not overweight because we overeat. So restricting our eating doesn't do anything except create a behavior that we never had before.
Yeah.
Right.
Yeah. Honestly,
We
I
never
feel
had
like
a problem with.
binge eating was worse because my food noise was so loud. Because and
Mhm.
so what I did is instead of like binge eating once, because of the lap band, I would drink and I would all day long I would eat.
Mhm.
And
Yeah.
because my body was like, we're gonna starve. We're gonna
Yeah.
starve, right? And
Yep.
which is not
Yeah.
true. But that's
And
what
it's not even your body, it's your brain.
my brain,
Our
yes.
brain is designed to stop two things: stop us from being eaten by a larger animal and to
Yes.
stop us from starving. We're an organism. As an organism, our job is to stay alive and propagate.
Yes.
Our brain, so when we start losing weight and we start restricting our calories, our brain immediately goes into defensive mode and stops it. And so we rebound.
Yeah.
And then the other is, and that's why exercise doesn't help with weight loss, because it puts us into this high stress situation that our brain's like, our brain can't tell the difference between running and being chased. So we start doing cardio, our heart rate goes up, our brain just thinks, oh shit, you're being chased by a lion. And your cortisol goes straight up.
Yeah.
So, I wish that we learned more about physiology in school. It would just relieve a lot of this.
Sure.
Because it's just that simply people just don't know how our bodies work. And what's sad though, many physicians don't know exactly how our
Many
bodies work.
physicians, yes.
Or they tune out. They learn it just to get past a test and then they let it go out of their brain, or they learn it and they don't learn how to apply it.
Yeah.
And
I will
that's the
tell you,
problem.
most of the doctors that have come on our show, like even the ones that are, specialists and really this is what they treat, have said legitimately when they were in med school, they had like one class on obesity, and that the class was just don't let them get obese.
Yeah.
Don't let them get obese. And when they do, tell them to lose weight, because that's where we're at.
I wouldn't even
How
call
do
it
you lose
that.
weight? You eat less and you move more. And that was the whole friggin' thing, right? Like, because it's only been 20 years or so.
Like a blip
you know?
Not even a blip. So basically what it is that we learn about weight loss when they think it causes something else. Joint pain, shortness of breath, deconditioning. They're just like, okay, well, tell your patients to lose some weight and they'll probably do better. But they don't say how. It's always, restrict your calories and exercise more. Meanwhile, most of the physicians who are saying this are also overweight because they haven't been able to do it either. Like I was, my BMI was over 40. I was 5 feet tall. I was 220 the last time I weighed myself, but probably more than that. And I'm sitting there telling people, well, if you wanted to get your diabetes under control, and if you wanted to stop this, all you have to do is lose weight. And I'm saying that, and one of my patients was like, look who's talking.
Yeah.
And I was just like,
Man, I'd have said that too. That's pretty delicious. You're like, well, I know. And I do remember like when you told us your story, like on our first season, you were saying that like, that your doctor even said like, you're embarrassed because you know better. Like,
yeah,
you're
well, how did you get yourself this way? You should know better.
You should know better. Right. But that's,
and mind you, this is the doctor I went to for help.
Nice. Right.
Yeah.
Like that's just not helpful. I did make this comparison. I had a troll. I'm trying to handle trolls with more grace these days.
Why? They're fun.
And honestly, because it makes me feel gross inside.
I know.
Someone that came on, I was trying to handle it with more grace instead of just being like, get out of here and boot them or whatever. Right. And I just was like, but it was evident to me though that the troll that was in there had taken the medicine and then she had like pancreatitis or something, right?
Okay.
Or some sort of issue, which you have talked specifically, I remember about, listen, recently your media spot was great, by the way, we got to talk about that. But specifically, like there are these signs, and if you ignore those signs and don't go see your doctor, then these things can happen, but they usually aren't just like quick onsets, right? In terms of these symptoms that turn into pancreatitis or gastroparesis and things like that, and so, but I could tell she was hurting. I could tell she felt left out. She couldn't take the medicine anymore. She was really big, and she was just warning everyone against it. You know what I mean? And so I was, that's funny.
What was that?
Not to do that when I'm recording on the podcast. And sorry, everybody, you know how Apple does the thing where it like shoots up balloons and stuff?
Yeah.
There we go.
Oh, cool.
Everybody's
so cool.
It's nice when I'm being serious and I'm like, boom, 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 because I talk with my hands. But anyway, now I can't remember what I was saying because I got balloon
Oh, you were
distracted.
just talking about the person being in painful. And I hate that
Yeah.
because the thing is,
I was
pancreatitis is
trying not
not
to
a
be cruel.
contraindication.
Yeah, I mean, like, I was just trying to be
Yeah.
like, listen,
Yeah.
I'm sorry you feel bad, right? But ultimately, and then she kind of went off on said all the things that trolls say. And so finally I was just like, look, here's the thing.
Yeah.
Clearly, food definitely plays a role in all of this. We all can agree that food, and I go, but when someone smokes, right?
Yeah.
When they smoke and then they end up with cancer, none of us say to them, right? No, you don't deserve it because you smoked and you knew better, right? Like nothing like that. Like,
Right.
and there is a direct correlation with that, right? I'm saying, like, so, but nobody says that because that would be barbaric, right?
Yeah.
But people have no problem saying that to us, right? Well, you don't deserve treatment. You don't deserve to live. You don't deserve, like, that's what you're saying. Like, I wish people would like grasp that, you know? And it shut her down pretty quick. And then eventually she kind of just sat there and was listening, I think, to feel a part of things, came back and said one more thing, and then I blocked her. But it's true. Like, we have to start thinking about this differently. You know, and I know that there are other creators and stuff where it is definitely like weight loss driven, right? Like that's the hook and that's what you bring them down and you're talking about the weight loss, but
it's not a weight loss drug.
It's not. I've been learning that from you from the beginning, but Kat and I looked at it that way, didn't we, Kat? Kat and I were like, oh, yeah.
Everybody did. Even I did. It was weight management drug. But the thing is, we keep calling it that mainly because it's a good marketing scheme. People everybody wants to lose weight. Nobody wants to admit they have a metabolic issue. And so, calling it a metabolic corrector, like, I don't have a metabolic problem. I may have weight I want to lose, but I don't have a metabolic, yeah, you do. So, at the same also, but the other with that makes me really sad. I see a lot of people who stop taking the medication for reasons that they didn't have to, or they stop medicine for reasons that they never go back because of reasons that they don't have to. And mainly because they have doctors who are just not comfortable because they've drank the Kool-Aid. Yes. And so, people have pancreatitis. Like I said, I've been prescribing this medication for 15 years for diabetics. Nobody gave a damn when it was for diabetics. Then I started using it for weight management before even Saxenda came out because I saw that my diabetics were losing so much weight, and I was put on Victoza and I started losing weight. So I'm like, this obviously makes people lose weight. So why not use it for that? Yeah. But the thing is that they keep saying pancreatitis. It is not, the medication itself does not cause pancreatitis. It causes rapid weight loss that causes gallstones that then cause pancreatitis. If you have your gallbladder out, once your gallbladder comes out, that's it. You're not at risk anymore.
Fascinating.
If you know that you have gallstones, but if you have gallstones and you do know that was the cause of your pancreatitis, then you know that then you need to get your gallbladder out. I mean, that's just, it's not the medication.
Wow.
And so I personally, if depending on, when people say, well, I had pancreatitis. Well, why did you have pancreatitis? Then we'll talk. Now, there are medications that can cause pancreatitis. And if someone has pancreatitis from those medications, then, you kind of want to watch them very, very closely, but they're still it's still not contraindicated. So, I'm willing to help people in the way that they need help. It's the art of medicine rather than only the science. And if people want to just stick to the science and learn the damn science.
Yeah, absolutely.
I
think it's interesting about the gallbladder thing. So like when I had it out, I went and I had 3 stones in my bile duct, and that was when I was very painful. And the surgeon came in and was like, well, first I had to take out the stones. There's like 2 different procedures to take them out, and then I got much better. And then he was like, I'm gonna make you hurt again because I'm gonna take out that gallbladder because it looks like there's noise in there. We got to get it out. It's bad. And I was like, all right. So then they take it out, right? And I say to him, I was like, listen, I'm on Mounjaro. Like, is it this or that? And he goes, no, like it's the fluctuation of estrogen throughout your life, right? Like, and if you think about it, that's kind of all of us. And the fact that many of us have struggled with obesity. And I remember one doctor one time said to me, you hold estrogen in your fat cells. Yeah. So I thought, well, if I was yo-yoing all the time, is that maybe another reason that the fluctuation would have been?
It's the 3 Fs. That's what we learned in med school. Is the 3 Fs. Female, fertile, fat.
Female, fertile, fat. Damn.
You get gallstones.
Yeah, I'm definitely those.
Guess who's on GLP-1s?
Who?
Women in their 40s who are overweight.
Yes.
So guess what? It's the exact same population. So you end up with the same people. That's why the correlation, it's not a causation. It might be
Yeah,
a
it's a
correlation, but not a
correlation.
causation. And
Yeah.
that's the problem. But once it's reported, that's it.
That's it.
The pharmaceutical companies are not going to let it drop.
Yeah. Well, yeah. And then I think a lot of doctors won't, they won't be like, hey,
Mhm.
do you want to try again? And maybe this time we try Mounjaro and we try it this way, right? Like
Mhm.
there are a lot of doctors that aren't even willing to take that risk, which
Yeah.
I find, I'm not saying that it's not painful for the patient. And I think they can know the risk and decide like, right, what it
Mhm.
is. But ultimately we are talking about like, and I do think we forget this, like
Mhm.
obesity is a vicious disease. Like it really is killing
It
us
is.
every day.
Yeah.
You know? And I've heard some doctors say that are against compound before. I've heard them say, no, like you're
I
not,
was.
it's not, I mean, I think a lot of doctors have said that,
Yeah.
right? Like
I was against
don't do
them.
compound, right? Because they're like, you should only be doing compound if you have some sort of like something you can't help it. Like it's a life-saving type of medication or something like that
Mhm.
because of the risk. And like, I understand that, but I think that what people maybe don't comprehend that sometimes, especially if you don't live in an obese body, right? That we are dying and we are sick and we are
Mhm.
miserable all the time. Like, you
Yeah.
know, and it's people are usually willing to take the risk,
Yeah.
and that's why I just always wanted to make sure everybody was taking a calculated risk, right?
Yeah. Well, this
And
is the thing. And then let's just be very honest
let's
about
do,
this.
yeah.
Most people who want to lose weight do not give a damn about their health at the time they want to lose weight.
Oh yeah,
When
good
they
point.
start.
Yeah,
Now, as time goes on and you start feeling better and you're like, whoa, weight loss really does do something. They're like,
Yeah.
suddenly I don't have headaches. I'm sleeping better. I'm not tired all day. My joints don't
Mhm.
hurt. And then suddenly it's like, okay, keeping the weight off becomes a health issue. But
yes.
starting the weight loss, really, most of us just
Just want to
want
lose
it
weight.
off.
Just want to
We
lose weight.
just want it off. We want to
Yeah.
stop looking a certain way. We want to be able to fit in clothes that look cute. We
Yeah,
just really just but there's nothing wrong with that either. And
yeah,
the reasons change. Me at 60 is different than me at 36 when I was 100 and 20 plus pounds heavier.
yeah,
Now if I were 120 pounds, it would probably kill me if I were 120 plus pounds heavier.
yeah,
Yeah.
yeah,
So now it's a health thing.
yeah,
Keeping the weight off is a health thing.
yeah.
Keeping
And that's
healthy,
where that
and not
chronic
even so much
energy.
keeping the weight off, keeping healthy keeps my weight off.
Yes. Yeah.
And
That
so, there's it, but at the same time, I'm not gonna lie, I do like being smaller. I like being able to shop.
Yeah.
Now that to say psychologically it was very difficult at first.
Yeah.
I still have a hard time shopping online because I always order the wrong size.
Same. I always order it too big.
Yeah, I always order stuff way too big.
Yeah.
But at the same time, I enjoy it. There's lots. You can be many things at once. You can want to be healthy, want to be pretty, want to be, it's like
Yeah.
you can be all those things at the same time.
Yeah.
And to pretend that that's not the case, I think
Yeah.
is disingenuous.
I think it's interesting, like when it was for me, I think that I never even considered like that I would look better because I never considered that it would work.
Mm,
Because everything I had ever done would work. I could lose 30 pounds and then regain 30. That's my number. 30
mhm.
pounds regain, 30 pounds regain. So I never really thought that it would work. And I remember when I hit past that first 30 pounds, I went, oh shit, what if
This
I'm
is
one of those
a-
people that could lose 100 pounds on this? What if I am?
Mhm.
And I
Yeah,
am one of those people. But
yeah.
like not everybody is. And I do think that's also like a common kind of like misconception. So because of that, then I think people get kind of unrealistic expectations.
Oh, absolutely.
Right. And then like I
Absolutely.
made this video where I was like, I'm just gonna say, like, so I made
Mhm,
this video and I was like, I'm happy that I'm still plus size
mhm.
because that's how I identify.
Yeah.
If I had to reckon with that,
Mhm.
I don't like that's really scary to me, right?
Yeah.
Like I'm excited that I can wear the biggest size in the normal person store, normal person, right?
Mhm.
And then
Yeah.
the smallest thing and then the plus size store. And if that shifted and if or when that shifts one day, that's
Mhm.
gonna be a big thing for me, you know?
Oh, absolutely.
Man, Dr. Toomer, most people are going through the same thing.
Yeah,
Like
I
we're
cried in the
we're
dressing room when I had to keep going down. I tried something on, it was too
yeah,
big. I went to the next size, it was too big. I went to the next, it was too big. And I just sat there and I just started crying and I walked out.
yeah.
I'm
Why
like,
do you
I'll
think
be
that is?
damned if I go down any lower
Why do you think that is? Just because you had identified that way for so long?
because I identified with that for so long. I was like, that's not me. That's
Yes,
just not
that's not
me.
me.
Wow.
Yes.
This is the thing. when it comes to health, anyway, we always say if you lose 5% of your body weight, your health improves.
Yeah, 5%.
So
That's
if
great.
you lose more than 5% of your body weight, your health. So it's not about BMI. I hate BMI.
Yeah.
It's not about BMI. It's about percentages.
Yeah.
So it's the same reason why I help people who've gained more than 5 or 10% of their body weight. I don't care what their BMI is. I'm going to help them lose it because I know what it's doing to their health. Unless they were underweight before. And that's why women who go through menopause, women who have polycystic ovary syndrome, women who have high stress jobs, who just gain weight through stress and just because it changes our glucose dysregulation. All these people are walking around with metabolic issues that don't fit the criteria because their BMIs aren't high enough. And then you have other people who are being told you need to do something who BMIs are higher, but they're healthy.
Yeah.
Health doesn't have a size. So if you've lost, a significant amount of weight, regardless of where you are, you're healthier.
Yeah. So true.
And the messaging is but it's so skewed. It's so hard to kind of, and it's so nuanced, and it's hard to kind of cut through the noise. It's really difficult. To be honest, I don't help people lose weight.
Yeah.
Even though I'm a weight loss doctor, so to speak.
I get it. Yeah.
I help people correct their metabolic processes, and their weight drops as a result.
Yeah.
Gotcha.
But people come to me because their weight represents something that's going on in their lives, something that's going on in their health, or some either psychosocial or biological health. Yeah. And so what weight allows me to do is to focus on their cause. And that cause rarely has anything to do with food. It has everything to do with what their body does with food, but it's not food in and of itself. Yeah. And that's why eating less doesn't work. Exercising more doesn't work unless it's muscle, which changes your metabolic issues. But even that muscle competes with that metabolic issue when trying to build. And so your body's constantly trying to take your food and make fat out of it. And your muscle's like, hey, I need fuel over here. And your mind's like, so what? We don't care. You got a metabolic issue. And guess what drives the train? Metabolic issues. And so that's why these medications work so damn well.
Yeah. Speaking of, you touched on menopause, and that's what we're going through. Miss Perry.
We're in perimenopause, but yeah.
Miss Perry. So there's so many symptoms. What?
It does. I'm 60, so I'm already way.
You're like, that's fine. I'm cool now. Literally.
Really.
Yeah, it's gone. So let's talk about that. Perimenopause. Can we run down some symptoms that some of us ladies would not realize it's actually peri? Like, oh, it's really peri.
Perimenopause is based on a drop, just so people know, as we get older as women, 3 things drop: our estrogen, our progesterone, and our testosterone. Estrogen dropping is what causes our weight gain, because when it drops, our cortisol then is left unopposed. When our cortisol is unopposed, we immediately our body starts pushing us towards diabetes. Yeah. So insulin resistance, cortisol high, insulin resistance, body gets really efficient in making fat, especially through the middle. Yeah. And that's dangerous fat too, because it's around your organs. So that's why otherwise it wouldn't matter. I mean, who cares if you have a bigger stomach, unless it's now causing health issues.
I see.
Heart disease being the biggest. Yeah. And so that's the estrogen. Progesterone is where the drop in progesterone is where you start having all the secondary symptoms: sweating, night sweats, not being able to sleep, brain fog, irritability, all those things. That's progesterone dropping. Yeah. And then you have testosterone that drops. That's when you lose your libido, you lose the thickness of your vaginal lining. That's when sex becomes painful. That's when urinary tract infections start to happen. That's when you start losing some of your, not your aggression, but some of the things that kind of give you that get up and go, and I'm just going to get this done, that type of feeling. And so replacing any of those, preferably all of those, either topically, which means vaginally, or systemically, unless it's contraindicated, reduces all of those things. the problem we run into is that we wait too late to start those things.
Yeah.
We always wait until our period stop. By then, all of those things have dropped to zero. And when that happens, but if you start earlier, it's preventative.
Yes.
So you can prevent the menopausal weight gain. You can prevent the menopausal insomnia and the irritability and the brain fog if you starting early. The problem we run into, though, is just like obesity in medical medicine, we learn so little about women's health in med school. And even those who are in charge of learning about women's health, the gynecologists, they also learn very little about menopause.
Mm-hmm. And PCOS, BT dubs.
Oh, PCOS is like,
I can't even.
I mean, they're like the unicorns of medicine.
Yeah.
Really.
It just don't really exist. We're just gonna,
you know, I
everything was me. Just lose weight. I'm like, there's cyst on my ovaries. My periods are 24 days. Like, what are you talking about? Like,
we know.
I really truly feel
that PCOS causes insulin resistance. That's why I put everybody on metformin.
Yeah.
I truly feel being on this GLP-1 and when perimenopause just kind of, popped up, I feel like, where would I be had I not been on a GLP-1? Like, I was already just a hot mess. Yeah. I had these like terrible periods that already alleviated it. And so then I go, I'm okay. And then here comes perimenopause. But I really feel like the GLP-1 helped kind of alleviate things.
That I will say, like, when I started the medicine from a PCOS perspective, specifically Mounjaro, I couldn't, because I get cyst, and every time when I ovulate for like a week, or when I'm trying to, right, I am in so much pain. And then eventually, and I remember it was almost immediate, the relief, almost there immediate from switching to that. Yeah. And then but I have had fluctuations, and I think it's perimenopause, right, recently, where I had another cyst and I was waiting for it to burst because I knew it was going to, right? Eventually, and I was just like popping Tylenol and Advil and all these different things, and I thought to myself, I can't fucking believe that I thought this was normal. And I lived like this my whole life. This was my every single month thing. Yeah. A week of pain, of horrible pain. Honestly, my periods were nowhere near as, because less blood, right? Yeah. But my periods weren't even really that bad, but it was the trying to ovulate part that was so freaking painful.
Well, the thing is, the part of the reason why the medication works so well is a couple of reasons. But, when you have insulin resistance, insulin resistance is a metabolic problem. And so the medication corrects that. The sad part is that I feel saddest for are women who have gone through infertility, not realizing that GLP-1 would reverse it. That makes me the most sad. You have women who could have been, because these medicines have been around for 20 years. So they could have easily had, and that's why they're like, oh, babies are being born because of Ozempic. And they're like, yeah, all these women are losing weight. Now they're having all this sex. No, that's not it, Joni. It's because their hormones are to the point where they can't. One, and also it drops, contraceptive effectiveness. But I mean, there is a psychosocial part of it. And part of it is that, you do lose your libido when your blood sugars are out of whack. And so when your blood sugars get corrected, it does correct. It's like it's multifactorial, but and that's why it bugs me so much when people say, weight loss, because that's really weight loss with the medications is one of the side effects.
Yeah.
And it's not what it's just that it's a favorable side effect because it makes pharmaceutical companies a lot of money because of that side effect. But, there are other things. It's a lot harder to say, if you take these medications, guess what? You're not going to have heart disease in 20 years. Nobody cares.
Yeah.
If they're not, that's not going to sell.
They're like, that's 20 years. Yeah.
Do you see them actually like using them like in clinical trials for menopause or aren't they still studying for heart disease?
Yeah, they're starting for dementia, addiction, menopause. One of the reasons why I like compounded meds so much, and this is actually, I was one of those people who really was anti-compound.
Yeah.
Particularly when it came to, particularly when it came to injectables. And I still am for the most part, mainly because it's too easy to get it wrong.
Yeah.
So I vetted. It took me 6 months. I mean, I really, and partly because I had too many people who were losing access.
Yes.
And I started having people come to me who really needed, it was so obvious they had metabolic issues, but they didn't fit the criteria of the brand. And the only way to correct their metabolic issues, rather than waiting until they got ill, was to use a compounded med. And that's why I changed my stance. And then again, I changed my stance partly because I found a good one. So that helped.
Yes.
But of course, we see what's happening, the threats and the fear tactics and all that sort of stuff.
I mean, for sure, like I will say, Kat and I, in the beginning, we were like, we would never take it down. Like you know what I mean?
Mm-hmm.
And then when everything got really bad with the shortage, I literally went to the doctors and I was like, I'm sorry, but if you guys are specialists, I'm going to need you to tell us what's safe, because if you don't, we're going to go buy stuff off the black market, because people make stupid decisions when they're sick and desperate. And that is that's the position that and it's not like a lot of people are like, oh God, I don't want to gain the weight back. Let me just tell you, the people that are panicking right now about losing compound, they don't care about gaining the weight back. They care about the pain. It hurts. They care. They don't want to go back. I've had someone say to me before recently, if I lose it, I'd rather be dead, because what I was before was dying and miserable and all the things. It's not just an overweight person. It's a person literally, like our body is like shutting down slowly.
Well, and this is something, and as like I said, as someone who's been prescribing these for 15 years, I can tell you, number one thing, people's like, I got off my blood pressure medicine.
Yeah.
And I don't want to go back.
Yeah.
Number two, I'm off my arthritis medicine and I don't want to go back. Number three, I can enjoy my family.
Yes, I can go do things.
I can do things. I'm not sitting in the house. I'm not short of breath. I can play with my grandchildren. I can, go for a walk after dinner when everyone says, let's go for a walk. I don't have to stay behind. Or I can go on trips with my family.
Trips. Yeah.
Because now they're not sitting. I don't have to sit for 15, 20 minutes every 100 yards.
Absolutely. It's all about the experiences. Like I remember when before I started this, we went to Disney World because I wanted to take my kid there. And it was the most horrible pain.
Experience. Yeah.
And I was trying so hard. I didn't want him to know how much I was hurting. And so I just kept pushing. I just kept pushing and kept pushing. And I saw a picture of us all together. We were with Mary Poppins, and that was the one that was on GMA. And and we were on Mary Poppins, or next to Mary Poppins. And I was like, just remembering like how much I wanted that to be this magical thing. Now it was for him because I was faking it the whole time and acting like I was great, right? Pushing it constantly. And but at the end of the day, my ankles were huge, my feet, my arches, all these different things, but now it's like the conversation for when the weekend is coming. It's not, I remember thinking to myself, the way I used to visualize the weekend was, oh, I got to rest. I can sleep, all these things. Now I'm like, the weekend's coming. What are we going to go do? Like what are we doing this weekend? What are we doing? Right? Because like this could all be over tomorrow. Like, and I actually have the ability to get up and go and do these things now. And I love that. Now, don't get me wrong. I take days where I don't do shit either, but I think that it's cool to like live, like have a ritual.
And everybody let pictures take it. You know what the saddest thing is? And this is something that it really hit home when my father-in-law passed away and we had to go look for photographs, and we had so many of him, we didn't know what to do. I mean, he had pictures with every single one of his grandchildren, every single one of his children, all of his people, everything, all these different outfits, and it was like the hardest part was picking out which ones. Like we just needed 10, and we had hundreds of pictures.
Yeah.
And I sat there, and I my daughter was like, I can tell you're getting sad. What's going on? And I said, because I know when the time comes, when people are going to have to look for pictures, there's going to be a huge gap. Aww. I have one photograph of me with my daughter when she was a baby. One.
I got to that.
Just
point.
one. I have no other photographs of her and me together as a baby. And her sister and I have maybe about 5 or 6.
Yeah.
That's it.
Because you're always behind the camera, right?
Or because I never let people take my picture. The only pictures I have are because my sister-in-law, who's like this photog, she's always taking pictures, took pictures of me when I wasn't paying attention.
Wow.
And that's the only reason I have a
I have
photograph.
very little before afters for when you're a
Mhm.
social media creator, everything's about the before and after. And I have very
Mhm.
little before, like, and
Because
on
nobody, yeah,
I
who
would
let
sit
you? Yeah,
down and I would be like, take a picture for the camera. And I have one
yeah,
before I started the medicine and I'm just
mhm,
oozing out of myself. Like,
yeah,
and I remember being so miserable, but also being like, oh, but this sweater is pretty and my face looks
mhm,
good. Like, I
yeah,
remember like thinking like that, you know what I
yeah.
mean?
Your face
And
is pretty. Yeah,
you know what I mean? Like, I would think, oh, my
yeah,
face is good. My face is pretty. Like, at least my face is
yeah,
because
yeah.
that for sure is the thing people would say to me, like when I would be
Mhm.
big and they'll go, but you're beautiful. I'm like, well, I didn't say I wasn't beautiful. I just said, I,
Yeah, exactly,
yeah,
exactly.
but it
Well,
was
this is
very
interesting
confident,
because,
you know?
and then of course size is very cultural as well. But
Yeah,
this is where just getting back to the original about men.
yeah,
Um, Men are not allowed to celebrate their transformations. We
interesting.
are. We can do before and afters, and it's quite
Yeah,
acceptable. When a
yeah.
man does a before and after, it's considered kind of lame
Because like, do they think that
societally.
it makes them look weaker because they're smaller? Like, is that this
It's
is
not even part of it. Part of it is because that's not what they're here for.
yeah,
Hmm.
They're here
Yeah.
to make money,
I'm not allowed to feel
or to
good.
protect physically
Provide. Yep.
and provide.
I
Their
see.
job isn't to try and
Really?
look
Yeah.
handsome, or
Wow.
their job is not trying to look small.
Small.
And the thing is, like, look at, I mean, size does, yes, large men, up to a point,
Yes.
but
Yeah.
the celebration is the problem, is the issue. We're allowed to celebrate. Men are not.
Really weird in social how we divide. Like,
Mm-hmm.
the division. I watched the Social Dilemma on Netflix. If you haven't seen that, watch that. That's some crazy
Mm.
shit. But true and scary. But because what was cool about that documentary is it was the people that made Facebook and Instagram
Mm-hmm.
and all the
The
social
right chicks,
that were
right?
Yeah.
like the executives coming up with like how to monetize and how to literally fuck with your mind
Oh yeah.
in order to do it. It's
Mm-hmm.
all a massive manipulation.
Yeah.
Like it's awful. Like it's scary as
Mm-hmm.
hell. But like the genie's out of the bottle. What are we going to do? You know?
Yeah.
And that I thought it was really fascinating. But it does
Yeah.
help you become a critical thinker because if you
Yeah.
see these things, like that's one thing I've noticed. Like there will be people like in like sort of our like I don't want to say our community because I don't know if that's fair, right? But I
Mm-hmm.
would say like sometimes the people that have the most followers are huge people. Like, and I'm just being like, and what I mean by that is
Mm-hmm.
in mass size, right?
Yeah.
Really big people that weigh like 6, 7, like whatever 100 pounds, right?
Mm-hmm.
Yeah. And
And
then
then we have people who are the other way around, and less people follow people that are in the middle that look like average or what we kind of consider maybe
Mm-hmm.
kind of teetering with weight. And
Mm-hmm.
I do think that's one because of the way the algorithm works, right?
Yeah.
But I do think there's something about that. Something Dr. Rosen did say on the show one time is he's like people like the spectacle, and
Yeah,
I think
it's
that
it's like it's like the woman with the beard at the circus. I mean,
yes,
that's kind of what this is. It's like it's
yes,
a circus. It's like, haha, better you than me,
yeah,
and
absolutely. But yet
people
they
want.
but
It's
they
it's basically
follow,
it's the same.
yeah,
Um, and it's really interesting, like the time that I see this quite often, especially because I help people who come
yeah,
to me, and there's a lot of resentment towards doctors. There's a lot of resentment
yeah,
towards people are who are perceived as being thin from people who aren't.
yes,
And so I get it often right at the beginning.
yeah,
Like people just like angry, they're angry with me. They project their anger onto me, even though I
mhm.
know they're not angry with me.
right,
And often what happens is that there's a resentment of me telling them what should happen because I don't look the part.
yeah,
And then what's really hard is I spend a lot of time trying to counter the self negativity. Well, they start off, I'm like, well, how old are you? How much do you, well, I used to, I exercise quite regularly and I eat pretty well. And stop with the this is my behavior and I'm blaming myself for the way I am.
yeah,
We've had enough of that.
yeah,
Instead, tell me what it is that you feel would help you feel better. That's all I need to know. I don't
yeah,
need to know all the things that somebody told you did or didn't do. And because I can tell you as someone who, which is weird. And it's so funny when I was 220 plus pounds, I had no problem telling people I was 220, 230, whatever pounds. Now it's really hard for me to tell how much I weigh.
Yeah.
But it's interesting. But how I weigh now, I eat way more now
Yeah.
than I did when I was
When I eat
100
less,
and something
I
pounds.
stop losing weight and sometimes gain weight.
Oh,
And
absolutely.
like I've noticed lately since I started the HRT,
Mhm.
and I've just been really, really busy, and
Mhm.
I won't eat, and I'm up like
Oh, your metabolism shuts
considerably.
down. Like I said, your
Yeah,
brain kicks in. It's just like, listen, you're starving. I'm
Yeah.
going to
yeah,
slow this all down.
yeah,
Yeah, I'm the only
and
one
I've been on
again.
the stall for a long time, which kind of goes into Kat's
Mhm.
question, but like for really, really, really long time. But again,
Mhm.
110
I
down.
forgot your question. I'm
This
sorry.
may just be a thing.
We just
No,
went way
no, I
off
should
on
do
a
it.
tangent.
Now,
Yeah.
But I think that like being like I was like, okay, well, this is just maybe where I'm at, right? This is like
Mhm.
my maintenance, right? This is the
Mhm.
healthiest me I can be in this moment on this medicine at this age with these
Mhm.
hormone issues, right? And
Yeah.
okay, and I'll kind of accept that, and that's cool. But then
Mhm.
but then the perimenopause has been kicking. I haven't been sleeping,
Yep.
all those. The sleeping thing is brutal.
sleeping's a big thing for your
Yeah.
Yes,
It's
and my
brutal,
weight.
brutal,
body's
brutal.
gaining weight, and that's I
Yeah.
when I
Because
gain.
of leptin.
Yeah,
Oh, the lack of leptin.
tell me about that. Let's
Yeah.
talk about
Yeah.
that.
Yeah, like I'm just like, well, I was gonna say like
Yeah,
whenever I'm tired, super
Mhm.
duper tired, all I want to do is eat all day. But then again, like
Mhm.
when I tell everybody like on the show, like I am the only person that did not experience food. Well, not the only one, but
Yeah.
not food aversion. I still think about food. In fact, I'm thinking about the
Mhm.
steak I made downstairs, and I'm going to
Oh,
go kill
yeah.
it.
To
listen,
me,
tomorrow's
that's the
Monday, I'm
perfect
thinking
combination.
about
But it just gives
Yeah.
me a nice firm wall, and I'm
Yeah.
appreciative of it.
yes.
Exactly. So this is what people always say, well, I'm not having any appetite suppression. Good. Like, what? Oh my, good.
I'm so
Enjoy your
normal
food.
on it.
Food should be enjoyable. If you don't have food noise, you should not have food suppression. The only
Yeah.
time you want someone to have, um, appetite suppression is
That's
if
another
they
bit there,
have a
Kim.
problem with
Right.
Yeah.
appetite and, um, enhancement. But
Yeah.
if their appetite has been normal all along and they don't have food noise,
Yeah.
not having
I
suppression
call it a
is
win.
actually a good thing
Yeah.
Mhm. Yeah, I
because
call it a
it
win.
means you're eating and your body doesn't get the message that you're starving and your brain doesn't shut everything down.
It's so crazy, like the way this all works. Like that's one thing
Yeah.
I've been telling people lately that I've been sort of picking up from the doctors on the show is that like your body gets okay. So like, how you hear us in the community talk about like kind of falling off the wagon. Like we use kind of like diet culture language like that.
Yeah.
Like, oh, I haven't been exercising. I haven't really quite been eating right. I'm going to get back on.
Mhm.
I'm going to become accountable
There's
again
no
to
such thing
this
as
thing.
falling off a wagon. You just step from one wagon to another.
I mean, right? Like, but I've been
Yeah.
trying to tell people because I want them to stop that. I've
Yeah.
been like, look, I know you're going to think that I'm saying you have no
Mhm.
accountability, right? I know
Yeah.
that's what you're going to hear. But what
But
I'm
that's
trying
not
to
it.
tell you is your brain's fucking with you, man. Like it's
Yeah.
telling you it's cool. Let's go have this. Let's go have it because it doesn't like that you lost weight. Like
Yeah.
you have to and then you go, oh, I recognize that's what's happening.
Mhm.
Shut up, brain. Let's get
Yeah.
back with what we do. But you have to, if you don't accept that this is a
Mhm.
disease, it's impossible. You will
Yeah.
continue to treat
Well,
yourself
what
like
the
garbage.
medication does is it keeps the brain at bay
Yeah.
so that the brain actually signals the way it's supposed to.
Yeah.
What happens otherwise is your brain just constantly miss signals. And this is something I try to explain the science and people just like, it's too
We like it.
sciencey for me.
No,
But
I love it.
pardon?
Explain it all.
Okay.
I love it.
Yeah,
So
we love sciencey.
these are our cells. Okay. So our cells basically are just these balls of and all these different shapes of things, but ultimately it's fluid on the inside. There's a wall around it, and there's little holes in the wall. And those little holes are what let things get in and out. And there's other things that attach to those that say, okay, hole open, hole close.
Okay.
Our insulin is what attaches to the cell and says cell open, and then our blood sugar goes in.
Okay.
So when you're insulin resistant, guess what happens? That's the insulin hits and bounces off because that it can't get into the keyhole to open it. And
Yeah.
so that hole never opens. So your blood sugar stays out here.
Yeah.
And so what happens in our brain needs the sugar inside to say, oh, you've eaten, stop. Oh, you've eaten. So now we can take what you eat next and turn it send it to your muscles instead of to fat cells. But if it doesn't get in, your brain's like, I'm not getting food. I'm not getting food. Store everything you get as fat because we don't know when you're going to get food again. I'm not getting food. I'm not getting food. Keep eating carbs. And so you just start eating carbs and carbs and carbs. So the problem with insulin resistance, anything that causes insulin resistance makes you want to eat carbs. Stress. Why do we eat sugar? Why do we eat bread? Why do we eat pasta? It's because our brain our cortisol levels go up. It causes insulin resistance. That key's not getting to the keyhole. The hole's not opening. The brain's like, okay, I'm not getting my drug, which is glucose. So eat more. And eat more of it. So everything that breaks down to glucose, which is carbohydrates and sugar, keep eating it until I get enough of it. But the problem is that the more your blood sugar goes up, the more the cells shut down because it's toxic.
Yes.
It starts this vicious cycle. And that's why you go from insulin resistance to pre-diabetes to then diabetes, because it just gets worse and worse and worse and worse. And so when people say, oh, I'm a stress eater, so when I always ask, what do you like? What do you eat when you're stressed? When people are like, oh, I start craving chocolate. I start craving this. I start craving that. I'm like, okay, you've got a metabolic issue.
Yeah.
They're like, what do you mean? No, it's not you. It's your brain.
I am going to send this episode to someone that reached out to me that said, I am a sugar addict. I am an addict. I'm an addict.
Absolutely.
I'm pretty sure you just have insulin.
Why do you think diabetics crave sugar?
Isn't there a book? There's a book called Recovering Sugar Addicts or something like there's something like of that. Yeah.
Probably.
But she's just starting Mounjaro, but she lost a bunch of weight on Ozempic. And
I love sweets. It's all right.
Sweets are good. Well, I don't know. It's weird though. On the medicine, I don't love sweets. I like a little.
I still love the sweets.
I eat a little bit.
I'll be right honest with you. I dropped my dose so I could enjoy sugar.
And you gonna enjoy sugar?
I appreciate that, Dr. Toomer.
I really liked food, and it was the problem is that it got to the point where I stopped enjoying the one thing that I enjoyed more than anything else, and that was food. And so I'm just like, I'd rather gain some weight and have. But guess what happened? I started eating more, and my weight actually went down. I'm like,
oh my gosh,
yeah, because my metabolism kicked in.
A crazy balance situation. It is.
And so one of the things that's really hard, and this is where, like I said, it's talked about the art of medicine versus the science of medicine.
Yeah.
When you are really paying attention to your patients, I can do that.
Yeah.
People get to a point, they're like, I think I need to go up on my medicine. I'm like, no, you need to come down.
Interesting.
And often what happens when coming down off their medication, their weight loss begins again. They stall. People assume you stall, you go up. No, sometimes when you stall, you need to come down.
So is it because you need to eat more and maybe you're eating more? So that's
sometimes stalls. There's many. And if anyone's interested, and not to plug my videos, but there's a video in my TikTok where I'm in a flower dress.
Okay.
And basically, it's like when you stop losing weight on this medication, these are the things that happen. One of them is your metabolic cause of weight gain has been corrected. So there's other reasons why you have extra fat in your body.
Yeah.
Some of it is your muscles too low.
Yeah.
Especially someone who's been a serial dieter. You've lost so much muscle over the years that your metabolism's shot. So even when you lose the fat, you've got nothing to pick up the rest of the metabolic process.
Yeah.
And so or you're eating too little. Your brain's like, hey, I'm starving, so I'm shutting this down.
Yeah, I'm definitely.
And so that's the other. And so, and then sometimes it's when you're on too much medication and you shut down your appetite too much.
Yeah.
That's what happens. And so you have to reverse that.
I was taking 15. And first of all, it made me exhausted. Eventually it passed, but I did it for 3 months. And A1C was good. But I was starving all the time. I ate constantly. I didn't gain any weight, but I ate constantly, and it made me terrified because I'm like, is this food noise? Is it coming back? Am I gonna But I was always just constantly eating, not tons of food, but just eating all the time. And I'm I've always wondered why that is, and I'm the only one that does.
Your blood sugar. That's another, because your brain functions and sends signals to the rest of the body based on your blood sugar and what the signal it gets in its cell of what sugar. So if your constantly dropping your blood sugar to the point where you're not replacing, your body's like keep replacing it because it's getting too low.
Yeah.
And so sometimes just dropping your dose will just stop that. Sister does branding. And she said, what's your word?
Definitely.
I'm like, my word? What do you mean?
My word.
I was like, word. She was like, no, your word. And I'm like, oh. And she was like, what is it that, and I said, it's courage. And it's like, it takes a lot of courage to transform. It really does. And it takes even more courage to use medication that everybody's just bad mouthing.
Yeah.
And it takes even more courage than to allow yourself to make those changes and to keep other people at bay who don't like who you're becoming.
Yes.
Because they can no longer take advantage of you.
Yeah.
They can no longer, you suddenly have boundaries. Like, I don't like you since you've lost all that weight.
Yeah.
You used to be nicer.
Yeah.
No, you used to be a pushover is what I used to be.
Yeah. I get that. Yeah, for sure. It makes so much sense. I love that. That's perfect. I don't know if I have a word. I don't know. I got to think about it.
Yeah.
Courage is a good one though. Dang.
Yeah. I like courage because that's kind of been the, I was told 25 years ago I wasn't supposed to be here.
Right? Like the courage to forgive yourself. Like that's a big thing. Like being like, oh, and forgive yourself. The negative self-talk that comes with all of this, right? And the believing and the shaming of yourself. Like, I mean, that it's a lot to overcome that. This is more of a mental journey than it is a physical one. I say it all the time. The
weight between your ears.
Itself, the mental stuff, the weight between the ears.
Yep. And that's actually how I came up with Your Light. Because I like to play on words, one, but two, because I kept thinking, what is it like? What is it? It's like you're kind of coming out of the dark. You're rising. You're coming. It's like a sunrise. And I'm like, what? Because I thought, what image do I want? And I was like, I want brightness and I want sunrise.
Yeah.
Which part of day do I love the most is sunrise or sunset. It's just that time. And I was like, ooh, you can do a lot with that vision, that image. Yeah. And then I thought of the song that I love, and which I used in my thing. And it's from Hair, and it's
musical Hair. That's right.
Yeah, and so which is basically if you hear the last scene of Hair is everybody takes their clothes off. And runs around naked.
Scandalous.
Yeah, it was in the 70s. So it was like, oh my God, all these hippie freaks. So anyway, but that's why, that's when I was at that age when I was suddenly becoming aware. Yeah. And so so when I heard, I was thinking, I think in soundtrack anyway, my whole day I'm just having music running through my head.
I love that.
And so I thought, sunshine. And I was like, there we go. We got light. And
because you are lighter, right? Mentally and physically.
Yeah. Mentally, physically, and it's like you're lighter, but you're brighter, and you're shining, and it's just like it's your time.
Absolutely,
it's your time to shine, and let everyone else be damned.
All right, we're going to keep that in right there. That's going to be our
everyone else be damned.
Everyone else be damned.
I love it. So everybody know all those things that we just said. We're going to put them in the show notes so that you can go follow Dr. Toomer. You can get care from Dr. Toomer. You can do Dr. Toomer's groups if you want to. You can go to her lives that she has on Tuesday. All of the different things in here. Follow her on.
And one thing I do want to say, I do respond. So if anyone goes in and puts a comment in my YouTube, that's probably the best way because I kind of see those more. Facebook messengers get lost. But if you put a comment, if you watch a video and you put a comment, I will respond to it. And if I don't respond, it's because I didn't see it.
Yeah. I love it.
Because I don't believe in people having questions and wanting things answered. And they have to find out. You shouldn't be searching for answers to your questions.
Honestly, I totally get that. I'm the same way. And so, because what I end up doing is I know if they don't hear from me, they're going to hear from someone who either doesn't know. And usually I know the piece of the question and then I point them to the doctors or I point them to the episodes of the shows about it because but if not, then it's just sitting there and they don't know. And they feel like, and
there's just, like I said, a little bit of knowledge can be dangerous.
Yes.
So I really try just enough to and there's a name for it there. What's the term? Is an effect. And basically what it is, people who know a lot think they don't know as much as they do, so they keep quiet. And people who know just a little act as if they know more than they do. And so their voices are louder.
No, I think that's true.
What's happening in this space.
In the space.
And I think that's why this podcast is so important.
Yeah. It's definitely like a library of knowledge. And like we just did an episode with a doctor. Wait, let's do our cutout and then I'm gonna tell you. Hold on. Ready? All right.
Okay.
Thanks everybody for joining us. It's been a lovely conversation. Thank you so much, Dr. Toomer. We love you to bits, and we'll have you on every season. And you and I are definitely going to go on the Oprah show. We are going on the Oprah podcast to talk about GLP-1s. I am manifesting it, and we're putting out there. It'll be like buddies.
Putting it out there. Oprah.
It's happening.
Okay, it's happening.
It's happening,
guys. Thank you so much for supporting us. Please consider becoming either a member or a paid subscriber on the podcast. It helps us continue our work, and we need help. Thanks. Okay, I asked. That was uncomfortable, but I did it. I love you guys, and we will see you next week. Bye.